ShelterCare was founded in 1970 as a community organization. It were members of the community that came together to create this service. And today we do our work on behalf of you, the community. We're your organization, and it's really important that you recognize that we're trying to do these services on your behalf. I'm standing in front of our Center for Programs and Services, an amazing addition to our array of services this year. Today we want to talk to you a little bit about the major highlights for last year, and we'll start with supported housing, which was a huge transformation.
This year we have completely restructured our supported housing programs, and we're really excited about it. Over 1,300 human hours of visioning, planning, communicating, and implementing has occurred. Tremendous amounts of effort has gone into moving ShelterCare's supported housing program from 5 individual programs to 1. Some highlights of our emerging model include increased consumer choice of service providers, increase in quality of integrated care, and by having a larger team, we allow our staff skill and focus on the area of expertise to be highlighted. We still have so much work to do as we continue to develop and implement our new supported housing model. The good news is that our talented, committed, and passionate team is up for that challenge.
We have brand new leadership for the Consumer Council, and with that leadership, a decision that they want to meet here at the Center for Programs and Services, which is very exciting for us. They met with the Board of Directors in October and described their top priorities, which is improving communication across the board and also introducing some new services that they feel are very important for their recovery in the community.
It is so important, especially in these times when we are having structural changes within the administration and the way that the programs are administered. It is so important to have that consumer input and cooperation, as well as the communication from staff to consumers to keep our confidence up. Last year, for the first time, we were able to organize a service day working for Habitat for Humanity on one of the community houses that they are building. Going forward, we would like to continue the service day with Habitat for Humanity on a quarterly basis. One of the first classes we're trying to organize is one which would help with life skills such as grocery shopping, meal planning, healthy eating, and everything related to that. And we're hoping to have that as a program-wide offering throughout all of ShelterCare at our new center downtown.
One of the real tragedies of the past year was losing Royal Avenue's crisis respite program for mental health clients experiencing crisis. We lost a lot of funding and ultimately had to close that service, which leaves a huge community gap. What's exciting about it for us, though, is that made a way for us to expand the very successful homeless medical respite that now is moved into that facility and is doing a remarkable job transitioning people who are homeless out of the hospital into safe housing so that they can recover. And we have a great rate of transferring them into permanent housing on their release from the homeless medical respite program. Along with some other community partners, St. Vincent de Paul and Catholic Community Services, ShelterCare has joined in the effort to work with child welfare to help reunite families so that children can be returned to their families. Our work is to create housing opportunities for those families so that those kids can be safe.
So SPURF, Strengthening, Preserving, and Reunifying Families, SPURF for short, is a program that works with families that are unstably housed that are referred to us through child welfare. I have a family that has been in recovery for a period of time from alcohol and drug abuse, and separately in each of their lives. He had a horrible eviction history with his ex-wife. She has a horrible eviction history from an abusive ex-husband. So they come together with 6 kids. They moved into a beautiful home. They've been homeless for the last 3 years. They're a hardworking, amazing family. They love their kids. They're so excited to be in their home.
So Wendy Dame is the new president of our board, and man, does she come with a lot of energy and excitement for us, and really is helping us think about this organization in very strategic ways.
I'm really proud of the board. Over the last 2 years, we were very involved in the acquisition of this beautiful building that I'm sitting in right now, which is an old timber warehouse that has recently been refurbished and now houses ShelterCare Center for Program and Services. And I'm very pleased with now the ability that ShelterCare has to offer a lot of services more efficiently and cost effectively. And as a board, we really want to continue to foster and nurture our relationship with the consumers to make sure that we can create an environment for them to be successful, to be able to live the fullest lives possible.
We are hugely grateful for the partnership you bring, the advocacy, the support, the resources you provide us, and hope that you feel in partnership with us as deeply as we feel that with you. Thank you.